Good morning. We are here for our COVID-19 update and well wishes for the Thanksgiving holiday that is just around the corner. I want to welcome all of our citizens, those who may be tuning in by way of Facebook, and I want to thank my colleagues for joining me today, this morning. We're joined today by Chief Chris James, our EMA Director and Fire Chief, and our Public Health Director, Dr. Stephen Goggins, and also Ms. Renee Gallup from University Hospital, University Healthcare System. We've got a lot of information to share, and I'm grateful to have these partners from around the region who have taken time to join me this morning in this press conference. This morning, we want to share several topics related to not only Augusta's data as it relates to COVID-19. We'll give a brief update on the governor's executive order that was reissued on 13 November. We will talk about Augusta's mask order. We'll share some information about hospitalizations and capacity, facts about the vaccine, and of course, new CDC health guidelines. To everyone from our community here in Augusta, I am confident, just as many of you are, that this has been a long haul. When you think about the fact that we began shutting down on March 16th to begin dealing with this pandemic in hopes of stopping the spread of the virus, and now we find ourselves almost 9 months later. We continue to see the persistence of COVID-19, but I want to remain vigilant, and I want to encourage all of our citizens to remain vigilant that we will get through this together. The stats that we'll share with you continue to show that this is not over, but we're right in the throes of continuing to fight. And so, as of this morning at 7:30, COVID-19 cases, cumulative cases, 9,652 cumulative cases. We've had 211 deaths in Augusta, Richmond County. As I have said on multiple occasions, those are not just numbers. Those are loved ones. Those are family members. Those are friends. Those are co-workers. Those are individuals that many of us know or have known. And we, again, reflect solemnly on their lives and their commitments and contributions to their families, to their loved ones, and their co-workers. Every time we come before you, I want to make sure that those who've lost their lives are not forgotten because of this pandemic. Between November the 5th and November the 18th, Augusta, Richmond County cases, we've seen 867 cases, which is approximately 66 cases per day, 433 cases per week. Dr. Goggins can certainly speak broadly to what we're seeing in the state of Georgia as it relates to cases. I won't belabor that, but we still do not find ourselves at a place in Georgia that we want to be. There's still more work to be done in terms of stopping the spread of the virus. And as we trek towards Thanksgiving holidays, all of us should be equally concerned and even more vigilant as it relates to the pandemic and its potential impact because of gatherings with families, loved ones, and friends. In terms of the Augusta Executive Order, on November the 9th, 2020, I extended the executive order mandating face coverings in public spaces through December the 9th, 2020. There will be a copy of Executive Order 2020-016 on the City of Augusta's website. You can view this by clicking COVID-19 alerts if you come to the main augustaga.gov website, and it will show you all of the latest information regarding COVID from the City of Augusta. In this order, we continue to share the following. We have seen individuals and establishments become lax in the City of Augusta. I believe there was a news report just a day ago within the last 24 to 36 hours expressing concern about individuals and business entities becoming lax in the City of Augusta. Let me unequivocally say this. We have not lost sight of the importance of everyone being in compliance with these issues and the importance of not only wearing a mask, washing our hands, and watching our distances, but if you are a commercial or retail establishment, it is vitally important for you to place placards on your place of business, more importantly, consistent with the Augusta Local Executive Order and Governor Kemp's executive order. There are requirements that when you are in a business establishment, that employees will in fact have on face coverings. In our order, we've indicated that all persons entering a commercial establishment as a consumer and all employees working in a commercial establishment, including but not limited to restaurants, retail stores, salons, grocery stores, and pharmacies in Augusta, are required to wear a face covering while having face-to-face interactions with each party. Employees that are working alone in a separate office space or in a workspace not accessible to the public and where social distancing can be done easily with sufficient space, there is no face covering or mask requirement. If an individual does not have a face covering when entering a government building, they will be provided one. If the individual refuses to accept and wear the mask, entry will be denied. This is consistent with what we've established months ago now, and we're going to become even more vigilant in this process. Why is this important? If we're going to continue to slow the spread of the virus, we cannot, as I've said before, take our foot off the gas and begin pumping the brakes. This is a real serious issue. When you look at the number of cases just over this last 14-day period of time, we have reason to be concerned. In terms of Governor Kemp's executive order, on November the 13th, our governor extended his executive order that renewed the public health state of emergency for Georgia, and the governor also issued an additional executive order that provides guidance for empowering a healthy Georgia. Some of the key takeaways from this executive order remain the requirements around entering and conducting businesses in commercial, retail establishments, including gyms, bars, restaurants, and those facilities. The governor also expressed concern around the long-term care facilities. In his executive order, the governor's shelter in place will continue for those defined by the CDC as being high risk of suffering from a severe illness. Language was added to his executive order that states that residents of long-term care facilities other than community living arrangements, community integration homes, can receive visitors permitted by the State Department of Public Health, of which I believe Dr. Goggins may speak to. Let me share this as it relates to long-term care facilities. This pandemic has been persistent, and many of us have elderly loved ones, family members, parents that we have not been able to see save for technology devices, whether that's FaceTime, Facebook, WhatsApp, or any of these technology tools that allow us to see our loved ones. And I, like many of you, understand that that cannot and will not replace a hug. I understand that that will not replace the human touch. And as we trek towards Thanksgiving, I want to encourage us to keep at the forefront of our minds that we would rather have our loved ones here for a long time than for them to contract the virus and we find ourselves challenged by them being in critical care conditions or situations. So please bear those things in mind as we think about how we handle our elderly loved ones who may be in long-term care facilities. In light of these executive orders, both the governor's and ours from a local standpoint, they're in place for one reason, and one reason only, and that is to provide for the health, the welfare, and safety of all of our citizens. As a city, we will continue to monitor the data and have daily conversations with our local and state health officials to make decisions that will protect Augustans. These are some things that we know. Currently, Georgia testing rates have significantly declined. making it difficult for us to interpret the current state of this epidemic. While we see individuals rushing to get tests before they travel for Thanksgiving, as a general rule of thumb, testing has declined. Georgia has seen stability in new cases and an increase in test positivity, suggesting that there is in fact under-testing. New hospital admissions in many cases are elevated at high plateau, which means that there's ongoing community spread. But the challenge about this spread is the following, and that is that in that 18 to 29 year age group, we're seeing higher incidences of COVID-19. That is extremely disconcerting, particularly when you think about young people coming home from college who, by definition, are not part of the normal family right now. And as they make their way back into the community and into their homes, I would urge parents to make sure that they have their children tested before they return home. I can't tell you what to do, but I certainly can encourage you that if you want a safe Thanksgiving, it will be wise to have that done. Because of the concerns around unrelenting and significant community spread initiated by social gatherings among friends and family, once again, I urge everyone to be very thoughtful about how you approach this year's Thanksgiving. I, like many of you, want to spend time with my brother who lives in Charleston, my sisters, my nieces and nephews, and I will get a chance to do that, but it will be virtual. We won't have an opportunity to come together because they've lived in a different environment, just like we have. And as cases continue to increase in Georgia, they're increasing in South Carolina as well. Exposure to asymptomatic cases, and this is a concern, can easily lead to spread as people unmask in private gatherings. You cannot show any symptoms and be asymptomatic and be a carrier of the virus. Unfortunately, so many of us are letting our guard down now because we do not feel any symptoms, we don't see any symptoms, and we think we're okay. But this is a grave concern for us in the city of Augusta because of the potential of community spread through asymptomatic individuals. Again, as we inch closer to Thanksgiving and holiday celebrations through December, we have to keep in mind that gatherings can also serve as super spreader events. I want to be with my family, but we will be there together virtually. I'd rather give a virtual hug now and be able to hug them physically when we get COVID under control. And at that, I'm going to pause here for a moment, and I'm going to ask Chief James to come up and give us an update about what our EMA Director and Fire Chief is seeing in Augusta and how we can remain prepared.
Good morning. And to reaffirm some of the information that the mayor has already presented and try to put in perspective of the effect that COVID is having. The mayor mentioned to you that the over 9,000 cases, and yesterday that number was 8,975. On Wednesday, it was, that number from yesterday had increased by 80 from Wednesday. And that's just so that you can understand at the rate that we're still getting positive tests, along with the concern that we are under testing at the same time. One of the things that the EMA office has been doing since the beginning of this is every other Wednesday we meet with all of the hospitals in our area. Augusta University, Doctors Hospital, Eisenhower Medical, the VA Medical Center downtown. We meet with Dr. Goggins and the Department of Public Health. We have our school board that participates in that meeting as well. This is all in an effort for us to find out what's going on, what resources are needed, and how we can continue to collaborate to get COVID under control. One of the main issues that we've talked about this past week has been hospital bed space. As we've watched this conversation take place on a national level, we discussed how this would take place and what's going on in our own region. Augusta University has 36 inpatient COVID patients. Doctors has 20 inpatients at their hospital. University has 46. While these numbers are important, is this represents a critical amount of their resources for their in their hospital for their critical care patients. Those beds are being used and taken up by COVID patients. It's not just COVID patients from Richmond County. Our hospitals serve a region. And so while Richmond County itself is very strong with our hospital resources, we serve a good portion of South Carolina, a good portion of the state of Georgia. And so some of our resources are being used in that manner as well. So what we'd like to advise you is follow the CDC guidelines as far as how we go into this holiday. One of the things we did in our meeting is talk with Fort Gordon and say, how are you educating, how are you talking to the soldiers that will be going home and then coming back? We're already talking about how they will be handling Exodus next month when they shut down and send everybody home pretty much. And then those come back. And they will be coming back, those soldiers will be coming back into our region. So those discussions in how they manage their soldiers and staff are being discussed because it has an effect on our community as well. And I will assure you that your hospitals, your health department, the city of Augusta, the mayor's office, the EMA office, we are constantly making sure that we have the resources that we need to help battle the COVID-19 virus. So for Thanksgiving, we do encourage you, stay home. Stay with your immediate family. Use the technology so that you can have a virtual Thanksgiving, whether it's through your phone, through your computer. But we have to take some of these extreme measures to get this under control so that we can get back to a new normal where our society can move forward. Also, if prior to Thanksgiving, you're going to get tested, if you get tested, assure that if you come back positive, that you still isolate yourself. While I know it's hard for people to separate themselves during this holiday, it is going to be very important because people will be getting together in small groups, that if you test positive, you truly have to isolate yourself. If you're going to get tested, we probably should have been tested already, considering Thanksgiving is this upcoming week. But if you're going to get tested prior to the holiday, please assure that you follow your doctor's guidelines, isolate yourself, and try your best to make sure that you protect yourself and your family as well. Thank you.
Next, we'll hear from Dr. Stephen Goggins, Director of our Public Health Office here. He will share updated health guidelines and also provide us an update as it relates to the vaccine. Followed by Dr. Goggins will be Ms. Renee Gallup from the University Healthcare System, who will come and share specific information as it relates to hospitalizations and what we as a community can and should be doing in order to help with that, particularly in light of the flu season. In that order.
All right. Good morning. So as usual, Mayor Davis did a great job talking about the data and where we stand in Richmond County. Nationally, we are at a peak that we haven't seen in this pandemic so far, generating over 180,000 cases yesterday. Fortunately, Georgia and Richmond County have not yet had that level of increase, but what we have seen, as you heard, is a steady, slower but steady increase in our local cases. We remain below our summer peak, but we are headed in the wrong direction. And that is given, too, that the holidays are coming up and cold weather, it does make us concerned for where we're headed. And the answer to that, I think, is going to be still our basic control measures. And in particular, that's important around Thanksgiving. So the CDC and Department of Public Health have issued guidance about Thanksgiving, and they have said, and I want to reiterate, as you've heard here, that it is recommended that you celebrate Thanksgiving just with the folks that you live with, your immediate home group. They recommend not traveling over Thanksgiving. The types of places where we have seen spread over the last month are events, social events, just like we tend to have for our holiday celebrations. And so it sounds like a significant change, and it is, and we understand that. But if you can limit your celebrations to the folks that are in your home, it will help limit the chance that this holiday significantly increases our case numbers. It's especially risky for holiday events if you have large groups, if you have people who are at high risk in the population, if you have to travel and use mass transit. If you go into a high-risk area, there are parts of the country now, the upper Midwest and Texas in particular, with just dramatic increases in cases. And if you yourself were a contact, or if you have a test pending, we recommend that you not travel or join holiday celebrations. There are some ways to help make celebrations safer. Virtual is the best, but there are some others. Keeping the group small, wearing masks, and potentially doing things outdoors. And there's a lot of information on both the CDC and public health websites. Now, we have good news about masks that have come out recently. We've always known that masks were very good at protecting the community. But the CDC did issue information in the last few weeks that new data says they're better at protecting the wearer than we thought. So cloth masks are actually effective in protecting the person who's wearing them. So now you have a chance not just to help your community and the people you're with, but it lessens your chance even more than we knew, wearing a multi-layer cloth mask. Now, we're also looking at a vaccine on the horizon. I hope that that gives everyone a sense of a possible end to all of these measures and will help motivate people to really focus on them over the next weeks and months until a vaccine can get distributed widely and administered across the population. There are two vaccines that have been in the news. They have come to the end of their, or are coming to the end of their phase 3 trials, and will probably be making requests for authorization from the FDA soon. And so we're very excited about that. The Department of Public Health is mainly focused on making a vaccine as available and easy to obtain as possible. And so we are in the process now of working with a variety of providers across the state to make arrangements for when a vaccine comes to get it distributed. We do anticipate that a vaccine would come out in small amounts early, and so it would be targeted at particular populations. Those are likely to be healthcare workers, for instance, the elderly, those with conditions that make them more at risk of a severe COVID-19 case. it is possible that vaccine will start to flow before the end of this year. So that's very good news. So, with that, I would just ask everyone to try their best to follow the basic mask, distance, and hand washing guidance. Adjust our holiday celebrations as much as we can to be safe, and know that we are looking forward to a more definitive answer to the coronavirus problem coming soon. Thank you.
Good morning. I wanted to share with you a little bit this morning about what's going on within the university healthcare system. I'm the Chief Operating Officer of the University Healthcare System, and we have ample capacity to care for the COVID-19 patients. We're in a unique position really at our hospital because we took the time and effort to build out Somerville campus to care for COVID-19 patients. And when we were doing that, we also renovated and made an intensive care unit there. That's really put us in the unique position to care for patients in cohorted areas. While we've done this, we've also increased our ability to take care of both the med-surg and intermediate patients on that campus. Since March, we've cared for more than 1,500 COVID-19 patients within our hospital who were sick enough to be admitted. At our peak on July 31st, we had 105 patients in our hospital. Only a few weeks ago, we went down to 19 patients, and today we're at 45. So you can see there's a great instability in this virus and how it is cared for throughout our community. We do have concerns over what's going to happen in the next few weeks and months that could bring stress to our capacity to care for our patients. Our nurses and our physicians and our support staff show up every day, energized and ready to care for our patients. However, their emotional toll and physical toll can't be ignored. We have the cohorted units. It's not something that anyone can continue to care for an extended period of time. Our staff really needs to be relieved. During that time, we have to have shift work, and they are continually relieved of taking care of the COVID-19 patients. We're now in our 9th month of caring for COVID-19 patients. We continue to follow the safeguards that we've put in place at University Hospital, and I'll talk about those now. We strictly enforce proper masking of all of our employees, physicians, patients, contractors, and visitors. We continue to limit visitation on our campuses. We have limited access to contractors and vendors throughout our healthcare system, and only those that are essential for our operations are allowed on campus. Our patients are pre-screened, including a COVID test before procedures. We have enforced social distancing in all areas. We have, as others have mentioned here today, strict sanitizing policies in place for the professional grade equipment that we have, as well as following the CDC and Department of Public Health recommendations. I think it's important to understand that the patients who are admitted to our hospital are very, very sick and often take months to fully recover. While we are ready to stand and do whatever we can to care for all patients, one COVID patient is too many when it can be avoided. University and other hospitals across this region have joined together in encouraging our community to practice the 3 W's. Wear a mask properly over your nose and mouth. Watch your distance. Wash your hands. Use hand sanitizer to clean your hands frequently. We at University Healthcare System are confident that we are doing everything within our power to care for and have all the safeguards in place for our patients to weather this pandemic. Flu season has created another need for hospitalization of patients. So these two coupled together, we really need to pay attention to watch our distance and wash our hands. We encourage you over the next 2 weeks to continue to do your part in limiting the spread of COVID-19. Thank you very much.
Thank you, Dr. Goggins. Thank you, Renee, for sharing that important information with us. I want to make sure that all of our citizens understand we're not trying to overwhelm you with information today. But what we are doing is wanting to make sure that we reach out and give the clarion call that the pandemic is still in front of us, and that together we're standing as a community, as one Augusta, and it's going to take all of us in order for us to continue to stem the tide of the spread of the virus while taking care of our loved ones. And so with that in mind, I think it's appropriate for us to take a few questions at this time. Take a few questions.
Mayor,
Yes, sir.
Dr. Goins was talking about the vaccines and all that, and we don't know when exactly we're going to get the vaccines ready to go, but can you say that Augustans will be able to get vaccines when they are widely available to the public?
Well, I think that what I can share with you, I've been on a series of calls, probably not unlike Dr. Goggins. He from a direct role in the Department of Public Health. I've been on a series of calls, my staff and I, with the U.S. Conference of Mayors, National League of Cities, and other entities, as we've worked with the current administration and had brief conversations with the incoming administration about the deployment of vaccines. Early on, there have been conversations about states being the gateway for this. Because Georgia is home to the CDC, we certainly are on deck to be one of those first locations for the deployment of that vaccine as a state. We will coordinate, again, as a city, with the Department of Public Health, leading those efforts with our healthcare community. And so the challenge for us is not having a clear date of when that distribution will be. Remember, as Dr. Goggins said, both Pfizer and Moderna, and now AstraZeneca, are in those stages of where they believe that they've got drugs that are 95% effective. And they're likely going to apply for, I believe, this emergency approval through the FDA, which then would allow them in pilot doses to deliver that to boots on the ground early on. I too share that sentiment that likely the tiered ladder of how that will be deployed will be our first responders, healthcare workers, and those elderly and highest incidences of comorbidities. That's what I can tell you based on all of the conversations that I've been a part of.
Mayor Davis, you mentioned that the city plans to be more vigilant in the coming weeks and months about enforcing mask ordinances and social distancing.
Mm-hmm.
What exactly does that mean? Does that mean stricter enforcement of fines? What does being more vigilant entail?
Well, being more vigilant will begin with this first. Again, I referenced the conversation within the last 24 to 36 hours. Our sheriff is not here with us today, but we certainly continue to be in close communications. We're going to have some pop-up stops at locations across this community. Those pop-up location stops will be unannounced. We're going to do that in random fashion. And as we do that, we're going to encourage, even as we place the executive order with mask requirements in place, we talked about an educational phase. Well, we're well beyond the educational phase at this point. And so perhaps even as we move into the next executive order, what we've seen some communities do is increase those fines because we're well beyond the educational phase. We don't want to be punitive. We want compliance. We want willful compliance. But here in the next 7 to 10 days, we will be randomly popping up at businesses, and we will be randomly showing ourselves in more vigilant ways, using all of the resources available to us as a city, and people will know that we're serious about this.
Thank you.
That was a non-political answer.
Yes, thank you.
Mr. Mayor, we're telling people to virtually Thanksgiving and stay within your bubble, and yet you call a press conference and invite everybody here. Do you think that maybe virtual would have been sending a better message than bringing people in person to a press conference?
Well, that's an outstanding question, George, and welcome to my bubble. This is probably the first time people have been in this chamber in months because we've created a bubble here. Were it not the case, then I would not have felt comfortable bringing you here. We considered having this conversation outside, but if we had done it outside, my eyes would be watering and I'd be cold. Yellow jackets do get cold, but yeah, I think we're okay here.
I have a question for Dr. Goggins.
Yes.
In terms of the vaccine, there's a lot of people in the community and all over the country that don't believe in vaccines, that are against vaccines and all that. Is there going to be a level that we need to reach in the population of people that are getting the vaccine to basically get rid of this virus, or is that still in the process of research?
Well, there's no way to answer that in numeric terms right now because we don't know the final effectiveness of the vaccines that we might be dealing with. Although the preliminary numbers we have are so encouraging, being well over 90%. The other thing I can say that I hope will be helpful and will come out, the trials for these vaccines are a little unusual. They're very large, and it's because of how you have to test a vaccine. But what that means is, for like the Pfizer vaccine, they're testing on 42,000 people. And that means that we will have safety data that's well broader than we would have on a lot of drugs at the time that this comes out. And so far, it looks like it is very safe. And that's also really encouraging. But I think we're going to know more about the safety on day one because of the large number of people tested than we have on a lot of things, and I think that'll be reassuring folks.
Question for Chief James. When you briefly mentioned Fort Gordon soldiers leaving next month, and then get concerns about them all returning, will they be required to quarantine when they return to base?
They have not advised us of that, but they will have some type of testing mechanism that they will be doing upon folks returning.
Thank you.
Is there, Chief James, is
Yes.
there any cases among firefighters and EMA personnel right now?
Yes. Currently, since the beginning of this pandemic to date, we've had 38 that have tested positive, and we've had a couple cases come in this week, which were part of that number of 38.